That's good. Oh, let's take it quickly. This episode 2, was about fun. And it's not funny.
It's like you guys dressed for the episode, you know.
It was quite a sad experience. Oh my god.
You mean how I felt? I didn't feel anything. I just called to make sure she was fine. Period. Thank you. You're welcome.
Okay, so this is the augmentation of the hips. I'm fascinated. The risky thing about liposuction and BBL, I would say it's majorly in the BBL path, because there has to be care when placing the fat or grafting the fat. It has to be done carefully so that it doesn't get to any blood vessel and cause a fat embolism. So that's what I would say is the risky part. Even the liposuction has to be done very gently as well.
It's not about the part where the nurse said my fat looked like mango period.
Explain. It's genetics now.
Are they fat? I said are they mangoes? Are they fats that don't look like mango period?
Fat is yellow. Every fat will look yellow, but by mango period, I mean soft. So it comes from your own genetics, your connective tissue, your diet to what you eat. Because when we have patients from abroad, the diaspora, we find that their fat is soft. But our patients here, for some reason, especially very dark skinned patients, there's a lot of fibrous tissue in the fat. So it's a connective tissue thing. I just meant it was quite easy to extract. Each patient's surgery is unique. No two patients are the same, even if they look alike. So for her, the entire team we put together. I'm the surgery coordinator, but as a medical doctor, I also assist in some of that. So after the consultant's review, after our cardiologist's review and clearance, the anesthesiologist's review, now the surgical team, we decided to proceed. She came into the theater, we did the cleaning, the anesthesia.
I was nervous.
And then, of course, she slept off at some point, and then we continued the procedure. And of course, what the anesthetist do is monitor. Look at you, look at the monitor. That's what they do. All true. Tell me to close my mouth. The recovery room is just to monitor the patient to emerge fully from anesthesia and to withstand the stress that has just happened. So it's about hours. It's not up to days. So anywhere from 6 to 8 hours, then the patient is already talking fully, they are awake, they can have some sips of water. If there's anything we want to do for them, maybe replace blood, we've done it, and they are feeling much stronger, they can now go to the ward. Most health institutions in the recovery room or immediate post-anesthesia period, taking videos or creating content is not really allowed. It's a vulnerable period or time for people who have done surgery, and there has been legal issues even around it, people revealing very personal stuff because they're still under anesthesia. So we do not allow videos during that time until the patient is fully awake, conversing and oriented.
Whoa, it's actually so swollen because of the drip. What are you saying about it?
On the arm.
So, when is this study supposed to start going on? Do you know?
Blood is looking good.
It's not the easy way out, though. You need to be very mentally prepared to do this. See how swollen I was in my hand.
That's it. It's not the easy way out.
This is not.
It's not the way you walk in the park at all.
My God.
Any attendance since day one?
It was a bit much for me. The moment they took off the compression garment, the blood drain was faster than normal, so I felt really lightheaded. This compression garment was controlling the amount of bleeding happening.
I was holding your body together. So once everything comes up now, you standing on like on its own and it's still sore, still healing. Do you feel more pain?
Yeah, I feel numbness. I feel pain sometimes, but I'm on pain meds. I look like it's the nausea. It's the nausea that is really irritating because I'm hungry. I want to eat.
As you already said, it is the nausea that is really irritating me.
The moment I take more than just a few sips of water or liquid, I can just puke. I'm even dehydrated, but I'm scared to take too much water at the time. And the swelling of my hands is so tight and I can barely make a fist.
But the doctor said these things are all normal, right?
To wear off with time, but there's no dates as to when because everybody's body type is different. What's making us nauseous? Our system is just adjusting.
The response to the
doctor said these things are all
pain
normal, right?
relief, most of them can make you feel nauseous. Then the entire stress of the surgery.
There's no dates as to when because everybody's body type is different.
Is there a particular fruit combo that you can be on?
No, but I prefer this one because it's carrots, oranges, and bell peppers. The bell pepper gives a tinge. It's not delicious, but it's rich enough to hold me and strengthen my immune system against. You want some? Okay, your mouth.
Bell peppers. That's healthy.
Jenna said that's healthy. She will not taste it at all. Never. Doctors advised that I walked around to prevent the risk of me having blood clots and to reduce the risk of me prolonging my recovery.
My name is Tochi and I'm a care nurse here and a spa therapist as well at Curvy Girl Essentials.
I just finished the surgery.
No, we are still on it. Maybe in an hour we'll be done.
Yes.
Well done.
Thank you so much. How do you
Well
feel?
done.
Pain.
Mm.
Okay. Oh, no, this one is not right. Okay. Yes. Don't worry, come on. You have an event. Don't worry, it's
I need to
okay.
cancel. I'm judging the beauty pageant.
Ooh. And today is 21st. Okay, November. You're good. You are. You're not don't cancel it up. You're good by then. Not canceling. Just that this swelling would have gone. The only place I'll be swelling up and down is this, the 360. That's it. And of which maybe you would wear something that you have to wear, maybe something soft inside that doesn't show. Yes. That's what you do.
Doing exactly what she said.
Yeah.
But then, yeah, you can actually go out. Don't worry, don't cancel any events. As long as it's next month, don't cancel.
So I was really worried because seeing the state I was in, I had a few things that I needed to do. I was supposed to judge a beauty pageant. I was supposed to participate in like a carol, like cover some Christmas songs and whatnot. Just seeing me drain and seeing me swollen and vomiting, I wasn't sure how long I was going to have to deal with that.
Yeah, so
It
she
was
was
comforting.
because that's her field, would I say, the post-op spa and recovery. So the timeline you gave her, she knew you would be fine. You just need to keep compressing the next session, but you'd be able to attend your events, make the, appearances you needed to make.
It didn't seem like so in the first place, but yeah, this was really.
We saw a video of you dancing at your event. Went viral.
Yeah, that's true. And I did a corset dress that
And
made it.
literally nobody thought anything about you know, the process and all. Is that what you wanted?
Absolutely. Dr. Dinma and her team executed excellently. Exactly what I wanted. Till now, nobody suspects that I've done anything. People are wondering I'm wearing padded boom. People are wondering why it's boom so low. They didn't know that after snatching the back and adding a little to the hip, it just accentuated what was already there. I mean, you can further buttress on how you always say, this is gorgeous and all yours. She always says it, so doctor speak.
Yeah, so like I always say, there's the responsible side to plastic surgery. Beauty is harmony. It has to balance, it has to
Let that sink in.
It has to blend the hip to thigh ratio, even the waist to hip ratio. I oftentimes tell my clients that you don't need to look like any other person. You're already good. It's not bad as it is, but it can be better. So we work with foundation, and that's what we did.
Honestly, I really
Shouldn't
did
be
not
too
want
much.
to look different from the girl that I used to see in the mirror before I had my kids. And that was a major concern for me. And after explaining to the doctor and her team, I was really excited. I still am very excited at the results because I look snatched. I look like Bam, but more snatched. And yeah.
You look good. Sorry.
She's
I
fine.
heard she has been training.
But today was
some
just
people. Okay. People today. Perfect. Like the earlier the better. Some people are constipated for like 7 days. And we start helping them distract. So now
Sorry,
we have
what do you mean by helping them?
It's best. It's like best. Yes, so yes, we do it for them.
I think it's the fresh juices and
Yes.
So you guys need to
Yeah. So what about smoothies? All of that. Because yes, they can bring her smoothies. It will help. Yes, now she can't eat. That's what they go through. You want these skills.
Incorporate
Yes. Yeah, I did mine December 2021, but you know, I'm very slim, so the fat is not much. Yeah, but I will do it again, but like.
Fear who knows
Why?
Why would anybody want to go through surgery twice?
Fear who knows
Why?
Why do you guys go back? Like it's almost traumatizing.
I think we forget when
when you're like healed and all of that, I think they just forget it. Pain, they forget pain. I know, I don't feel like I did. Going through all of this now, I don't feel like I'm interesting. That's why maybe they will start saying all those things like it's like, oh yeah, it's big, yeah, it's not big, my stomach is not flat and I'll go back and lie down.
I will work out. I will go to the gym now to maintain. I will go to the gym. I will work out. Why do I want to go under that knife and process twice, 3 times? Who are you?
Sincerely, well, should we were the ones still attending to me 2 times, 3 times. If they want still fix something, we're here. But
Fix
personally, I also
healing takes 6 months. Why would I want to wait for 6 months and go do it again?
yeah.
No.
And this buttresses the fact where I say you can't do this and then leave exercise and dieting. I still preach dieting, exercise, living healthy, maintaining your weight. I still preach it
Honestly.
very loud. Because surgery is not a hobby. It's a risk each time. So,
You know,
just
we were
like
saying
you, I
earlier.
can't.
I don't trust you. You've seen it done so many times and done it so many times that you're gonna do it. I don't trust you. But I'm so grateful that I had a healthy lifestyle and before, and that's what has really helped with my healing. I think I'm 6 weeks post-op today.
Yeah.
Yes.
Yeah, about 6 weeks.
About 6 weeks post-op. I'm still on the fruits, the juices, I can't do so much exercise now, so I'm pacing myself.
Yeah, getting
And
your
all of that.
massages,
Just got my
compressing.
Person,
It's
please,
a
very
long-term
organic.
thing.
It's a lifestyle change completely, honestly. But nobody should do this 2-3 times. You guys don't do it. More grace to you.
Okay. Don't mind me, it involves a lot of things, the pain, all the preparations. Yeah, it's not easy.
I hope you want this out. Do you want this out that you did?
No, I'm
saying it.
actually Curvy Girl 2.0, so
Come on.
there's nothing. Yeah, don't worry about it, I'm good.
2.0 right here.
Don't worry about it, I'm good. That's just what is, because I'm her like second. That is the explanation I can give to being Curvy Girl 2.0. I'm like her sister, her biggest supporter, and just someone who is really invested in this business going forward. So I feel that's how I got the name 2.0. Curvy Girl 2.0. Yeah.
Do you feel nostalgic about it?
What does that mean?
Do you miss
Miss what? No, ma'am, I don't.
Well, I miss it. Not because I enjoy you being in pain,
So you
but
miss watching me go through.
no. It's just the whole experience of it.
My thoughts for me are not good, but able to wish me an unexpected end. I'm understanding you now.
This end was expected. It does look good. Let's continue.
Yeah, so we are good. You're not hiding anything from us. Yeah. I'm glad you're feeling good.
Just need this. It's nothing that can
It will calm down. The pineapple juices will help a whole lot.
Is there any pineapple in anything you did for me?
Yeah, I think. Haven't you finished that? No, I didn't. Okay, no.
Which one? Okay. This one. Yeah, just small pineapple. Yeah. Let's go down.
Girl, I'll send for it.
Yes. I just came out to drink water. I'm going back to the table.
Oh, okay.
Alright.
Well, thank you. Well done. Bye.
It's going well. Very well. She's slim, so we'll be done enough. See her coming back to the second round, but it's okay. So it's okay. Don't worry. No, she was not coming back.
She's not coming back.
She won't come back. This is good.
The face I was looking for.
No, this one is trying to.
Man.
She's just saying things to
Like she naturally eats healthy and then she has
Yes.
personal trainer, so
Yeah, that's
she's
nice.
yeah, she's maintained it. So I'm going to come back. Thank you so much. You're welcome.
Thank you. Bye.
So I think
Okay.
I was a great patient though.
Yes, that's what I'm nostalgic about.
After fame, there are certain features that I wanted to alter, especially my teeth, and then I didn't know that pregnancy was going to change me, so it wasn't like lipo was ever anything I thought I would consider in the future. Thank you, darling. So just after my second pregnancy, I didn't like who I saw in the mirror. It started to affect me emotionally and mentally, and I really gave it a whole lot of thought. My husband wasn't complaining, but I didn't like how I felt. So for mothers, wives who have gone through pregnancy and are uncomfortable with the person they see in the mirror, even if our husbands don't see anything, for our own mental and emotional well-being, it is possible to go through a 360 lipo and BBL without altering who you were before the baby too much and accentuating who that woman was, where confidence, your self-esteem, with or without your husband's compliment, for yourself and for your psyche. It is possible to go through this safely and come out looking amazing. The difference between this and fitness is that you see the results even though you're going through pain, discomfort. You stand in front of the mirror and you're squatting and you're like this. You're happy. The volunteer. Oh God. Hey, people recorded all this. Sorry.
So, can we talk about something?
More volunteer.
People need to understand the extent.
I would have just had juice, thinking I'm okay. 2-7.
At some point, you started heaving, like there was nothing else to throw up.
You're such a sweet nurse.
Dr. Dinma, how important is it for your nurses to be kind? Is that part of the things you look out for?
It's not even negotiable. I can't even work with somebody who is not patient, empathic, respectful, kind. Because our patients in this industry are different. It's about beauty. It's not like the usual, okay, maybe someone is pregnant or someone was sick or someone has a broken bone. Here the person came well, the person came okay, and nothing ever prepares anybody for what they will experience. So the ability to be patient, to wait on that person, the patient is an extension, it's like your child.
It's a nature skill.
So it's important for me that the nurses, you listen, you attend, you empathize, you help, you clean, whatever you have to do in that time so that the patient recovers and gets back to doing things normally. So it's a must.
Well, how do you tell though? Like during your interview process, is there a way you can tell?
Okay, most of my staff come by recommendation. It's like 90% of them. I don't leave it to chance. I would have had someone vet and say, oh, this person, she's calm, she's kind. Let her come on board on your team if you don't mind.
She or he?
I've always had female nurses.
I don't have any energy. I just want
Should you try and do what?
Blow air into that to exercise her lungs.
Oh, okay.
So, some people go through this once in a while. Even my boss is said to One was in and out of the hospital every day. She kept on vomiting. She finished a full carton of pasta. Yes. So she was running temperature, vomiting, and stooling. So some people react to so many ways in the recovery. Some will feel so tired, you think it is malaria, why it's not. It's just part of the life of fever. So sorry, but you'll be okay.
Just the one cut off.
I thought I did not hear right.
So where is the nostalgia?
No, I'm not nostalgic about this one. So, there's something that I also wish people knew, the things to expect after this surgery, because here some people sound very, for example, when they say I was bleeding. No, you were not bleeding, you were draining. And draining is expected for the first 5 days plus. Another thing that is expected is bruising, which is some redness around the skin. And then again, things like this vomiting. Why? Because the stress of the surgery has upset you. That's one thing. Second thing is the pain relief medication. So this can trigger the vomiting centers, and you'll find out that you're irritated and you want to throw up. Anesthesia effect too still causes vomiting. Sometimes the compression garment is a little too tight. You're not used to wearing something that's firm, and then you eat and try to lie down. You feel like vomiting. Yes.
Put pressure on it.
Yeah, so it's one of the things that can happen after surgery. What do we do? Because we give you a bag, we stand by your side, and then we give you things to stop the vomiting because it can be uncomfortable. We give you medications. If we need to, we give you IV fluids and encourage you. It should stop. And then if we have to, we change the opioids that are causing the vomiting. We change the medication. So that was quite an ordeal.
It wasn't funny.
But it will pass. But it will pass.
God, how did I was done. But I just couldn't run away from my body.
What?
Can you hear that? How long has this been standing? Okay. How long has she been standing? You can check also. Sure. And I had a procedure. It's the same thing. I was just trying. So some people, the physiology is like that. Some people, it's the medications that are irritating. Some people, that is your body's response to the surgery or anesthesia. Yeah. So we're giving you things already to help with it. The last flagell, if you're still vomiting them, we know it's one of the pain relief. Because me, I thought it was pain relief. But Dr. actually said it's most likely the flagell. Is that 15 minutes?
No.
But does she walk around?
Yeah, I was about to say that she's not strong enough to walk around.
Even the vomiting is
Draining, yeah.
It's tiring. Well, how are we in terms of total inputs for fluid? Even though I'm not counting.
Look at my face. Dara! Why did you have the courage to keep recording this?
I felt so guilty.
Takes, we must get the input.
I even had the mind to be checking me out.
So this is day 3 post-surgery. How are you feeling, B?
Feels fine today, to be honest. They put a lot of things to numb my body. And there's lipo. So I'm feeling it wear out, so I'm already feeling some pains around my rib cage area, my waist, a bit of my back. But I had a better appetite today. I already had pap and pepper soup to smell.
So let's throw in our
Yeah, whatever it is they gave me, has tamed the vomiting.
No, she was just, you were just, she. You mean you? You were saying here that
Did you just say she, you?
she was. Okay, so you.
I can't believe you just did that. Look how we cut it.
Bambam, she you? Really? You were saying that you feel better now. The antiemetics we gave and stopped the vomiting. But of course, it's day 3, 4, and you begin to feel pain.
Yeah, I was wondering that was that not too quick? And she said between 3 to 4 days when we start feeling.
Most of the patients say, yeah, the pain has started.
God. I thought you said that he was coming. And he told me that he's been coming since.
I think we'll be here soon.
He said, baby, it's not like that. I'm seeing you soon. This is the 3rd day. You do anyhow, you return my bride price. I'm available for new relationships. I'm brand new.
Do you know the gag? When he now came, he now said, feeling brand new. I'm like, that's what he literally said.
What I said.
I said that was not planned. That was not planned. That was not planned.
I return the money. I know you paid for this. I'll return your money. What do you mean? What do you take me for? It's supposed to be able to rubbing my thighs and my body. Just stay in the house. I know you're working, but baby, come on, I missed you now.
Okay.
That was so good. Yeah, I'm brand new. How about that bride price returns? But he came later.
I'm not there.
The response, we're culprits. Accessory to murder.
I'm not there.
Ooh, first massage.
No.
Yeah.
The best part.
What waist? That was so painful.
You're doing a good job. She's doing a good job taking it. So, post-op massages.
That was very painful. And after a while, I got lightheaded.
Yeah, it can
Why?
happen. Because you've been lying down, now you're standing for a longer time. As you drain, also, it's like the brain has calculated all that fluid and now you're letting it go. So you feel lightheaded and dizzy. So post-op massages are very important. Except your surgeon says his own style is not like that. But for us,
What does that mean?
post-op massages, some surgeons will say no, don't. The care is important. If not, those places will be stiff, they will be inflamed, they will be painful, fluid will accumulate. And of course, if the care is not effective, there will be complications like fibrosis. It's important for massages to be done to help with draining and for the nurses to always look at the incision sites and ensure that there's no infection. Yes. It's important. That's a cleaning process and it's not easy. You know, when you hear massage, you think it's relaxing.
No. No, it's
This
not
one-
full body relax. They press all the stiffness into.
You need to be strong to bear
It's
it.
quite painful.
Yes, but after the drain stop, then you can start to massage in the spa, lie down, and maybe it gets relaxing at that point. But initially, you need to be strong to bear through it. And it's not that bad though. In the end, you feel relieved.
No, like you feel lighter, you sleep better.
Yes, after.
You would feel blood circulating properly, actually.
Yeah.
Please, nobody should miss their massages after surgery. Save your money very well.
For more sessions.
Have enough sessions
Okay.
till you're fully recovered. These are things.
Bami Care, who had just had liposuction and BBL, the most important thing for her to do was first adhere to instructions. Everything we've said. Don't sit for this period. Wear your compression garment for 22 hours in a day. Don't take a lot of salty food because that makes you swell up more. Salt goes with water. Avoid alcohol. Get your massages even though they are uncomfortable and painful. The first 2 weeks, 14 days straight, she'll get the manual lymphatic massages. This is done with only hands, and then afterwards she can start to use machines for treatments such as the radio frequency ultrasound. Again, for her, when she's around 6 to 8 weeks, we can now begin to use other tougher equipment or instruments such as the wood.
Look like they
So
they look like they're from medieval times.
yes, so that's for the massages. We are also going to attend to her wounds and ensure the incisions heal without getting infected. And then basically for the bum, she's not meant to sit until we say so.
They gave me the best treatment. I don't know if anybody else enjoyed like it.
It's on my back side. I don't press too hard.
You feeling brand new yet? Hey, wow. What a win. Almost. Hey. You know this dude. Wow.
I'm so happy to see you.
I'm so happy to see him. I'm so happy. Because he's been through some stress.
I think that's when you had the bathroom.
Okay. So sometimes that happens because one, you've changed the environment, so you're not in your usual, like the way you're used to. You just change the environment, and there's people opening the doors every now and then to check something, give you something.
Actually happens.
Yes. Some people report that their sleep has changed. They feel they're not at peace or at rest, or they are having weird dreams or bad dreams. It can happen. Sometimes the medication, but majorly a change of environment. You're not in your usual place, so that can happen. Some anesthesia drugs have been implicated, but I don't think they are still working at that time. So for me, I would say it's a change of your usual pattern or your familiar environment.
That could stimulate in
That can happen. And then again, you sleep all day and then you're awake at night. So the kind of sleep you're getting at night is different too. Sometimes it will be like you know, all those, you think you were sleeping, then you just woke up. You could have all those startling. So it's a change in your circadian rhythm. That's what we call it. Sleep cycle and environment can cause that. So you were
yeah, a cinematographer, Sha. I didn't even know she captured this.
Nothing goes past time.
This is so good.
It's day 4 and I'm feeling better.
I'm very hungry. I'm craving swim. Better hot. Please tell me that we captured the obono. Aye, the good part.
How are you feeling today?
Amazing. You guys tricked me. I was on level 1. Now you're putting me on level 2 after my massage.
Yes.
My body feels good.
Enjoy your new one.
Thank you so much.
Bye.
This is so sweet. Shout out to Nurse Dockers. Pineapple juice. It's an anti-inflammatory. It's so good.
It's your eba. Then she will say yes. So, adequate nutrition after surgery.
The anti-inflammatory. Now we skip to the good part. See how happy I am just watching myself eat after vomiting. Finally, food could stay. A girl can be happy in peace.
So it's more about the food.
Yes.
Okay.
With joy.
So,
I thought you were asking for shrimp, salmon. Oh, what are we? What was it?
we can see if you try rice. These are all mashed potatoes and salmon. It's very good.
Or quinoa with shrimps and filet fish. I don't do rice.
What are you so happy about, Iba? I'm going to put. I'm going to put those
chefs.
Those.
Yes, so please,
the chefs here, premium, impressive. Like I was eating pepper soup and white rice, and semo, poundo, native jollof spaghetti. Ladies,
Yeah.
it was amazing.
So please, after surgery, the vomiting may
Won't
make
pass.
you feel like you don't have appetite. But once you catch a break, eat very well. Tell you for future. Don't worry about the fat coming back or anything, because at that point your body needs the building blocks to heal you, and you get it from food and medication. So spare no ever. Eat very well. Eat very. Eat as much as you have appetite, and then take juices and everything. You need the nutrition. Don't diet anything in the first 2 months.
That's what she
Don't
told
worry
me.
about it.
That's what
Eat
she
well. Foodie.
Watch me eat. I don't play movies yet.
Okay.
Yes, I've been feeling great.
Taco Bell is it's
Just ending with Dara shots.
What's firstly?
Nothing. What did you say?
You,
Me?
asked about vaginoplasty.
And I didn't want nobody getting it twisted that I have. I don't
Do you
need that.
understand so far? I believe things are quite, uptight and
Have you visited that region that you're talking things that they not as though they were?
I haven't gone.
What was that?
Oh,
Do you want us to start a podcast? I think we'll kill it. Yeah, I think so too.
the champions. I know this girl will put on the camera. Because I always have random moments like that.
They're so refreshing.
So, yeah, let's go.
And action. My name's Bambam.
Sorry.
My name is Dr. Dinma.
No, he's Chidinma and something. You cannot just be putting Dinma.
Okay.
No. Tell us your full name. Sorry, let's be serious. Okay. Introduce yourself.